Welcome to OsteoBites, everybody. My name is Anne Graham. I'm an OsteoWarrior and Executive Director of MIB Agents. Today is a so great day on OsteoBites because we get to speak with 4 of our junior board members on topics that they chose to speak about. Junior board, would you get us started by introducing yourselves, please?
Hi, my name is Skrubis. I'm 20 years old from upstate New York. I was diagnosed in January of 2020. I had a left above the knee amputation and I just finished immunotherapy.
Hey everyone, my name is Friedman. I'm 24 from Northern New Jersey, junior board member, and we'll get into some of the details about my treatment.
Hi, my name is Charlotte Murdoff. I'm 17 years old from California. I was diagnosed with Osteosarcoma in July of 2018, and I had limb salvage surgery. I'm currently in treatment, and I had a pleurectomy surgery 3 weeks ago.
Hi everyone, my name is Maeve Smart. I am a 2-time osteosarcoma survivor and currently a student at Northeastern University in Boston. I also am serving as the junior board president for this year and really honored to be here today with my fellow junior board members. So thanks for coming.
Honored to have you guys. Thanks for being here. Before we get started, I wanted to say thank you to those who have outrun, outwalked, outbiked, or outcrawled osteosarcoma. If you did, you likely pre-met some of our junior board members on our outrunning app. They thanked you and some of them trash talked you through the app as you sweated through your outrunning journey. If you haven't helped outrun osteosarcoma yet, please join or create a team. It's so important to us at MIB, to what we do. It supports our mission to make it better for kids with osteosarcoma. Thank you to BTG Specialty Pharmaceuticals for their sponsorship. Please go to mibagents.org/outrunning to join us. Thank you very much for doing so. So let's get started. Charlotte, no, Kara, over to you.
Hi everyone, I'm both honored and excited to be speaking to you all on behalf of MIB Agents on things I wish I knew before treatment. I wanted to preface my presentation by saying that not all of these wishes I will explain would be true for every individual. Everyone's experience is unique, and my hope today is to help inform anyone looking for support or how to support a friend with some suggestions from a survivor. There are many more points I would have touched on, but for the sake of my time period, I chose the most important ones to me personally. Before I start my presentation, I thought it would be best to introduce myself and my experience, as it plays a large role of who I am today. My name is Skrubis. I'm 20 years old and I'm from Ithaca, New York. I love dancing, art, fashion, and studying in college. In January of 2020, months before the pandemic hit, I was diagnosed with osteosarcoma in my left tibia. This came from a 3-month misdiagnosis of a knee sprain. I was 18, a freshman dance major at the time, with dreams of being a ballerina. I endured 9 months of, as we all know, harsh chemotherapy and opted to have a left above the knee amputation. I finished chemotherapy in September of 2020 and then did 8 months of immunotherapy. I completed 48 doses of immunotherapy less than a month ago. Life for me now consists of giving back in the ways that I can, advocating to end all childhood cancers, and studying psychology and health and human services in college with hopes of becoming a certified child life specialist. I serve on the junior board in MIB and I'm grateful to be part of such an amazing organization speaking to you all today. Today, I wanted to focus on a question I often ask myself: what do I wish I knew before starting treatment? I've broken this down into 3 sections: mental health, physical health, and of course, MIB agents. Feel free to stop me at any time for questions, leave them in the chat, or there will be a Q&A at the end. And of course, if there's anything I did not cover today, feel free to mention it, as all suggestions are valued. I took this picture near the end of my treatment. I remember the only reason why I took it was because I was so astonished I looked the way I did, and honestly, I did not like the way I looked. My mental health was affected far more than I thought it would pre-treatment. What I needed to hear was that I did not owe anything to anyone. I did not owe an apology no matter the guilt I felt. I did not owe a text back when I couldn't muster up the energy to respond. And the most important to me, I did not owe it to anyone, even myself, to pretend to be okay. You are allowed to have the feelings you have. Going off of that, if you're having a bad day, a bad week, whatever it is okay to ask for help. There is no shame going on medication to help psychologically. There is no shame in therapy, and there is no shame in just a good cry. Healing is not linear. It takes work, but it is okay to have days where you just don't want to work on it. With this came the mentality that really helped me once I adopted it. Take it one day at a time. When that becomes too hard, take it an hour at a time, and so on. Sometimes the only thing I could really focus on was the now, and that really helped me through. And as a last point, everyone's journey is different. I did not realize that just because someone had the same cancer as me, their life could go in a completely different path. Comparing myself to others did not help me, but reminding myself that everyone is different pushed me through. Moving on to physically, I felt like I could have benefited if I had heard that it is important to ask questions, have different opinions, and if you're able to, have an advocate there for you. There are many different medications, different treatments, different surgeries out there, and the best way to learn is to ask. Having a support or advocate there for you can ensure that you're getting what you need on those days you just can't build up the energy to do it yourself. We're all humans, even doctors, and mistakes can happen, so asking questions and getting second opinions is a big one for me. MIB was a great service to me during treatment, encouraging me to see a sarcoma specialist, something I had not thought about before. My first round of chemo was tough. I didn't have a set plan in place for what meds I would take when, but as soon as I did, it got a bit easier. I studied the meds available to me and came up with a personalized nausea plan. I ended up taking every nausea medicine possible, and that was okay. It is what got me through. And lastly, set goals. I started to set goals for myself throughout treatment, and it gave me some sort of structure. Some days those goals were as simple as brushing my teeth, and other days it was to do PT. Goals made me feel like I was progressing, even on the days it was hard for me to see or feel that. And so we're on to our favorite organization, MIB Agents. I wish I had known about MIB Agents. So many things to say about that statement. I started to get support through MIB around halfway through my treatments. Just a click to their website, you can see support through programs, patient and caregivers, bereaved parents, physicians, researchers, and more. They have lots of support geared towards patients themselves, including ambassador agents, gaming agents, prayer requests, warrior mails, a book, Osteosarcoma from Our Family to Yours, and more. I was paired up with an ambassador agent that made me feel less lonely, being the only individual on my unit with osteosarcoma. In so many ways have they supported me, and being there to talk to you has been so great. I would encourage you all to tell your local hospitals about MIB, spread the word, just because you never know who might need this useful information and support and get it just at the right time. MIB Agents has taught me that giving back can be healing. It took me some time to get to this point, but on the days that this disease makes me mad and angry, I am quickly comforted by the knowledge that my fellow junior board members and I are actively making it better every day. And I'll open it up to questions.
Kara, you so do make it better every day. Seriously. Everybody, if you don't know Kara, you need to know Kara. She has, if you're on TikTok, she's on as SKRUTHAT, and screw that, SKRUTHAT. Such good content on osteosarcoma and being a person with osteosarcoma, so good. Really grateful to have all of our junior board members as part of our leadership team. Kara brings her own special brand of magic, as each one does. Kara, can I ask you, so this is I'm going to ask you kind of a heavy question.
Yeah.
if you could give back the experience of having had osteosarcoma, would you?
I think if you would have asked me that question a couple months ago, I would have said yes, very selflessly. The more far out I am from treatment and the more I am learning about kids and their stories, the more I'm grateful for what I've gone through and what I can teach others, as well as now I feel like I have a true purpose in life to make it better for kids and to do something in the world.
One of the questions we got in advance was, what compelled you to continue in this space? I mean, it's hard. And I know this because when we take a group back to a hospital, or we're kind of in, we're back in the hospital space or in a treatment space again, or in a Ronald McDonald house and we're doing a video or something, I know I'm like, I'll walk in and just smell it and be like, and so we all have some PTSD around like just being in this space, even if it's not the physical space, just hearing somebody's story and remembering it's hard. What astonishes me is the people like our junior board who chooses to go back into that space to serve others. It's not easy. It's particularly hard, in fact. Just washing your hands in a hospital and walking around with that smell of that soap on your hands and getting it near your face makes me want to, well, puts me right back in that space again. So how did you decide that giving back and being back in this space was for you?
I think for me, being treated in a pediatric hospital really had a lot of impact on me mentally. I was easily the oldest kid on the unit, and just seeing everyone else and their stories really hit me. I feel like for me, this is something that's kind of hard to forget. And the more I learn about how little funding, how little research there is, I just am really hit with the need of finding a cure and finding better treatments. And hopefully that's what we can work towards.
Okay, last question for you. Unless anybody has any questions, by the way, attendees, please write or type your questions in chat or in Q&A. In the meantime, another question we got was, did first-line treatment work for you?
So I finished chemotherapy, the MAP protocol, in September of 2020. I do have good scans. Then I went on to immunotherapy just as a preventative treatment. So far, I have good scans. I have 3-month scans since I'm pretty new to being out of treatment, but hopefully it stays that way.
I hope so too. Okay, thanks so much, Kara. That was awesome. Thank you. Brandon, ready to roll?
Yep. Thanks, Kara. So I will be talking about life after osteosarcoma and the emotional, physical, and social obstacles for both the patient and the caregiver that come with that. And why I picked this was because physically, throughout treatment, I was okay. I'm tough in that sense, but in regard to the mental that comes after, not so strong. So I found that to be really difficult, and I'm sure other people will or have. And I wanted to share what my thoughts are behind the things that come after osteosarcoma and how to help navigate that. So I'm Brandon Friedman from Northern New Jersey, and I was diagnosed with osteosarcoma in the proximal left tibia, similar to Kara, in January 2019. I had limb salvage surgery in April of 2019, and then I graduated from University of Maryland while in treatment in May of 2019, and went on to complete my treatment in October of 2019. So I've been cancer-free for about 2 years now, and I'm living in New York City, and I work for Citibank full-time. So the emotional obstacles that come along after OS is the scanxiety, that like gut-wrenching feeling of when you feel like you could be back to normal, but then, you know, you're ambushed with a doctor's appointment where you have to go feel those nerves again. And, you know, how I like to reframe this is that doctors are your best friends. The checkups and the scans are a really big positive, and they help you detect any abnormality early so it can get taken care of, you know, rapidly if needed. And skipping appointments won't stop cancer from coming back or growing. So if it's going to happen, you want to be on top of it anyway. So that goes right into the fear of reoccurrence. And, you know, this is something that one of my nurses told me, that just because you're a cancer survivor, it doesn't mean you're not allowed to have normal human being, you know, symptoms like pains or stomach aches, headaches, a cold, pain, bone, tweak this. You know, it's not always going to be cancer. And in most cases, it really isn't. I remember, you know, after finishing treatment, maybe 3 months after, I got a cold and I had a cough, and I immediately called my oncologist and I said, you know, something's wrong. You have to bring me in and check me out. And she said, you have a cold. We'll see you, you know, when you're scheduled to come in, you know, take a deep breath. And of course, 2 days later, I got better because it was a cold. You know, and just overall emotional distress and well-being, using your resources, speaking with a mental health professional, you know, creating an environment that makes you feel at ease and not bring back, as Anne said, those PTSD feelings. You know, all throughout treatment, my mom used this specific hair conditioner, and now if I smell it, it like really sends me right back to that feeling. So when she knows she's going to see me, she doesn't use it, which is, you know, very thoughtful and nice. So, you know, with sarcoma, the physical aspect is really the biggest thing. And, you know, for most of us, if not 99%, it goes on for the rest of your life until, you know, hopefully there's some sort of medical technology where we're all getting limbs and, you know, biological connections, etc. But the rehab of a lost or operated limb, it's tough and it's aggravating and stressful, but you just have to be patient. And, you know, recovering muscle and function takes a lot of hard work, effort, and time. And you have a team of medical professionals like your surgeon, physical therapist, who work with you. You know, I had a couple problems with my operation that led my recovery to being much slower than, you know, what the average was for a similar surgery. And I remember I looked at my surgeon, I said, do you think I'll be able to climb stairs foot over foot, you know, within the next couple years? Because that was something I couldn't do, but it was important to me. And he looked at me and he said, truthfully, you know, I'm not sure. We're going to have to see how everything heals and how you do. And 3 months from that appointment, I was going up and down stairs, you know, just by putting in the work and being patient and setting goals, which, you know, really meant a lot to me. The feeling of being functionally disabled. So this is a really important way to think about it is, you know, we're not disabled because of what we went through and the, you know, the medical attention we received. We're now enabled to do the things that we want to do and we can do. You know, we were given a second chance to, you know, still hold on to those things. So what I like to do is I like to, you know, when I'm feeling down that my friends are going to play pickup basketball and I can't do that, or they're playing softball or going for a jog, you know, it is frustrating to be 24 and not be able to do those things. But what I do is I list the things out that I can do or look through pictures of things I've done. And, you know, it makes me happy and proud to see I can do things. And the fear of injury, which is, you know, something that I'm sure all of us feel and will feel, you know, just being nervous of a slip or a fall. Just be smart, using your best judgment. You know, if it's raining out and icy, don't go outside without, you know, a brace or a cane or wearing flip-flops. So just being smart and being proactive about, you know, keeping your legs safe. So some of the social problems that you can run into. So it's hard for me to connect to, younger adolescents where, the people around you, let's say you're anywhere from 8 to 12, don't really understand what's going on. Being 21 when I was diagnosed, everyone pretty much around me in my social settings knew what it was, but just being confident in your body and your functional aids. We're unique and special people. And, if you're using crutches or you wear a cast or you use a cane or a knee brace, if you saw in the pictures from the opening slides, I was playing golf and hiking in Arizona, and, I was in a knee brace and I was proud. I was just happy to be out there, happy to be hiking, happy to be on a golf course. I didn't care that people were looking, at my knee brace, and to them, they probably think it's just a knee sprain. It, doesn't have to be a heavy story. So anyway, for the benefit of us, most people only care about themselves. They're not even looking, or, they're not even judging. They're indifferent to it. So socially feeling alone, luckily here we all are with MIB Agents. It's, the epicenter to not feel alone in this. There's such a wonderful organization and network where you can connect with people of all different ages, from teens to even older. There's really someone for everyone with a similar experience that can really connect, and you can use, the organization as a resource. And owning your own story. If you want to tell someone about the story, then do. And if you don't, then don't, and what's the most important is having the people, closest to you, such as best friends or family, respecting your decision on the story, where, it's not their story to share, it's your story. So if you don't want it shared, they should respect that as well. And that's for, parents on the line too. So, those are some of the hardships of life after, and how I like to, kind of wrangle them in. So if there's any questions, please feel free to, ask away.
Thanks, Brandon. I love so much about what you said, and I have lots of questions, and I have a couple of questions that also came in. The first, I'm going to ask everybody this question. If you could give back osteosarcoma, if you have the choice, knowing what you know now, would you give it back?
It's such a tough question. It's how, I guess, you weigh the physical sacrifice of it versus what it makes you as a person. And it happened for a reason, and I'm hopeful that my life guides it that way. So, I'm okay to accept it and go forward with it and see, why this happened, and figure that out. There will be a point where I see the purpose of it, which will be, if I am not already.
Well, I think you are. And I think also you, just by telling your story and what you're doing with your life today, is working at City, that's a really big deal. And just telling your story, just that part of telling your story offers a lot of hope, because as a parent, when you have a child going through this, you're like, what's going to happen to, all of these plans that I know my child wanted to be an astronaut, or I know my child is in hotel school at Cornell, or whatever the case is, you have sort of expectations of yourself and expectations of your child, and here you are, like you're doing
Right.
this really cool job in New York City.
Yeah, no, there's hope. There is, and getting to, a relatively normal life is totally feasible and absolutely within the cards. You may not be able, as I said, to play pickup sports, which bums you out, but you can leave your apartment or home, go to a dinner, spend time with your loved ones, there's trade-offs. You trade some physical things for growing, monumentally as a person.
Was it, so you were 21 when you were diagnosed. Did you go back to school? Like, were you in school at the time? Oh, sorry.
So,
stop share while I'm, thanks.
So I was diagnosed in the gap between the first semester and the second semester of my senior year. So I finished my senior year, the second semester, online while going through treatment. University of Maryland was very accommodating, where they allowed me to take in-person classes online, and I was able to finish on time. So I graduated during treatment.
I mean, it's just amazing. I seriously, I couldn't lift my head off the pillow, like to study on any level, like to even read a book. Like I was so weak. Like I remember like the book just sort of flopping over. So my husband got me a Kindle because it was lighter and I could read a book. Like it's pretty amazing that what you did and that you did it. So post treatment, did you find it difficult to relate to people your own age afterwards because they hadn't sort of faced death? And
it does, and that is there. And as you get further and further away and kind of start to participate in normal life, you kind of come back to earth in that sense. But I do remember in the very beginning complaints that other people have, I didn't really have the patience to listen to, like, someone getting really riled up about missing a subway, whereas like, oh, you missed your subway, like I'm, getting chemotherapy, or I feel terrible, afterwards, but that's also when you work with a mental health specialist, they teach you ways to, cognitively reframe and understand that, not everyone is so, they're not understanding of what you went through, and it's just life.
Good point on mental health on that level, because otherwise you would have no patience for, especially kids, I think, who go through this during high school or middle school. How do you go back and relate to, I don't like my parents? It's like,
yeah.
You go through this, your parents are kind of all you have, like every day, day in and day out, and siblings. So yeah, hard to deal with that. Can you go downstairs? How are you at downstairs?
Downstairs, good.
You can do
downstairs, it's kind of just like bend my knee a little and then drop my body weight and catch myself on the other leg, but it works.
Okay, that's my style too.
Yeah, exactly.
That is totally how I roll. Okay, also wanted to say that completely relate to you, just like the past month, just randomly, and I think it's allergies, but I'll just be like, and I'll be like, oh my God, do I have lung meds now? Like, it's like crazy. And I know, like, when I say it out loud, I'm like laughing at myself because that's not what that is. But and I'm 10 years out. Like, I'm 10 years out, July 10th this year, 10 years out, and I'm still going, oh my gosh, what was that cough? Like, what? So I don't think that's ever going to go away. And then two, you said something about limb salvage surgery having, you have these aches and pains, and sometimes it feels like a boa constrictor is like around your limb salvage leg. I know when I've overdone it, and it's like, there's a long time before you can level out on, okay, what's normal and what's not normal, and when do I need to call and say, I think I have a problem. Like, totally relate to that. Yeah, difficult thing. Okay, couple questions. Oh, good question. How did you find MIB Agents? That's for Kara and Brandon.
I found MIB through a fellow boy with osteosarcoma who was being treated at the same hospital that I was. He was very involved with MIB, and sadly he passed. And when he passed, I decided to get involved in, as a thank you to him, because he was ahead of me in his treatment, So he kind of showed me the way.
That was a really good question. Thanks, Gabriella. I never thought to ask you that question. That's a good one. And then a question for everybody. Were you offered immunotherapy or any other post-treatment maintenance therapy? I think, Kara, you answered this question, but go ahead and just reiterate. Everybody can answer that.
Yeah. So the immunotherapy I received was not FDA approved in the United States. So it was a little bit of a jump to get it, but still a lot of people receive it in the US. So that's the only post-treatment therapy I was offered and also needed.
Yeah, so Kara, I'm not sure if you're discussing mifamrotide. I know that's the big one. So because of those FDA restrictions, it's not, I believe, unless things have changed in a year, I don't think it's offered, as a standard of treatment. It's more of a patient initiative to seek it out in addition to their standard treatment. That's, everyone in the country gets the same thing from the, children's cancer, something. So, I had heard about it and we discussed it, but just between my medical team and my family, I elected not to receive it.
I was not, but I am a bit farther out in treatment, so that may be why.
I actually received the same one that Kara did. It was really actually hard to get the drug. My parents had to fight pretty hard to get it into the US, and all these papers and side effects we had to learn about. But I wasn't able to finish it because of, I think I had problems with fluid around my lungs and my heart from another chemo.
Okay, other question for the whole group, which Kara already answered this. Did first-line treatment work for you?
So this first line treatment, just the first initial mapping of standard protocol, yes, it did.
I had a local recurrence about 2 years after finishing first line therapy, but I'm now 7 years, no evidence of disease, so doing well after having an above knee amputation.
Initially for me, it worked about until like 8 months out, I had a relapse.
Well, Charlotte, since your mic is on.
All right.
Get going. And Brandon, thank you. Really, really helpful. Really helpful. Thank you.
Hi, everyone. I'm Charlotte, and today I'm going to be talking about what it's like to be a patient in a clinical trial. So a little bit about myself. I'm 17 years old and going to be a senior in high school. I'm treated at UCSF Mission Bay in San Francisco, California. I was diagnosed with osteosarcoma at age 14 in my right femur. I received MAP treatment, had a limb salvage surgery, and due to multiple relapses, I've had multiple chemotherapies, 2 thoracotomies, a CAR T-cell trial, and recently a pleurectomy. So what is a clinical trial? It is a scientific study conducted using humans, and the goal is to find new therapies, procedures, and treatments. So how does it work? So researchers test new drugs or treatments that they have on animals or in cell dishes. And from this, they obtain preclinical research. And if this research is promising and has the potential to improve the care of patients, they can start their clinical trial. Most to all clinical trials have 4 phases. The first mostly focusing on safety and dosing. The second focusing on effectiveness. And the third phase is when they can usually expand the trial so more patients can participate. And in the fourth phase, the trial can be approved by the FDA. So how can you find clinical trials? There are 2 easy ways to find. The first is MIBagents.org, where you can take this quiz and it will find you a clinical trial in under 60 seconds. Or you can also visit clinicaltrials.org.gov, where there's a search criteria. And I've learned from my parents that you could consider searching by solid tumors, as you may get a better range of answers. So some pros and cons of clinical trials. Obviously, in a clinical trial, it has the potential to work, and it could possibly slow the spread of your cancer. And being a patient in the clinical trial, you are providing more data and research and information. But also, the clinical trial is not guaranteed to work, and they are a risk because there are known but also unknown side effects that doctors don't know about. Usually clinical trials are in a different location than where you live, so that could mean separation from your family. So the trial that I participated in was in Seattle, Washington. Luckily, my trial was outpatient, but I did have to stay there for 5 weeks. It was a CAR T cell trial that targeted the protein EGFR that I expressed highly in my nodules, which is the reason that we chose this trial. And I was treated at Seattle Children's. So how did my trial work? There was kind of two main steps, I would say, steps. So the first thing they had to do was something called an apheresis, where they remove blood 6 weeks prior, and this blood circulates and separates the T cells from the rest of the blood, and the remaining blood goes back into your body. Then those T cells are genetically engineered to attack cells that express the protein EGFR. Then I was given a chemotherapy to lower my immune system, which has shown that the T cells could work better when I have a lower immune system. And then those T cells were injected back into my body. So here on the left photo is the 55 million T cells. And on the right is the nurse giving them to me, which I received in under 1 minute. So the ups and downs of my trial. So luckily, as I said, it was not an inpatient therapy. So I was able to be home, which was the Seattle city, where I stayed in a condo where my parents switched off coming. I was able to have visitors, which was great. So you can see my friend here. And I was able to explore the city. So I went to a Seattle Mariners game with my family because I was feeling so good. I also had a 47% engraftment, which meant that my T cells multiplied in an insane amount, which also turned out to be a down because it caused an unexpected liver complication, which led me to be in the hospital for a couple, to be watched. I was also away from family and friends, which made me miss them, but I was able to FaceTime the ones who couldn't visit. And sadly, I am still recovering from this liver incident. So, yes. So my results, so the results that I had a chest CT scan 6 weeks after my cells were injected back into my body. I had a mixed result. Some of my nodules in my lungs shrunk, some stayed the same size, and I did have a few new nodules. And my doctor said that that was a pretty good response, and that's mostly what they had been having. And here am I with my doctor and my social. Thank you so much for watching. And do you have any questions?
Yeah, how did you get to be so amazing? That's one of my questions. Because you just had a pleurolectomy.
Yeah.
How long ago?
3 weeks. Yeah.
It's just amazing. You just continue to amaze, Charlotte, just truly. I did have a question about the blood they took out and then extracted the T cells and then put the blood back in.
Yeah.
In the time, like, did they take out so much blood to get those T cells out that
Yeah.
why did they have to put it back in? Was it because it was
Yeah, it was like a 4-hour process of just blood going out and like circulating in this big machine. And so I think I would have lost a lot of blood if they didn't put it back in.
Okay, so then how long before they put the blood back in? The 4-hour process?
Oh, so a 4-hour process, I think it just kind of goes back, it like just circulates and then just comes back in. Like
Okay,
a
okay.
minute. Yeah.
I was thinking they like took it out.
Oh, no. It's
Oh,
like
put it back in.
going back and forth. Yeah.
Yeah. Wow. Okay.
It was pretty
I was
crazy.
thinking, like, in the meantime, did you have to be in the hospital? Because that would have been really, you've been.
Yeah, it was like this big machine next to me, like shaking with the blood in it. It was pretty crazy.
Yeah. I think most people I know, I certainly did when I get an IV, I'm freezing cold like the whole
Yeah.
time anyway. So you must have been like a popsicle.
Yeah, I had like 3 blankets on me. It was crazy.
Yeah, crazy. Okay, from Sabine, you're so mature. Charlotte, I think probably is for everybody. Way beyond your years. I take my hat off to you. How easy or difficult was it to decide to participate in a clinical trial?
Well, we were kind of at a point of like, I had done all of the chemotherapies that have been out here, and I did an immunotherapy, and we were just looking at options because that was kind of all that was left. And we were looking at 2 different clinical trials, and we just decided on this one. We just, there was a chance that it would work, so we took that chance.
How has osteosarcoma changed you?
That's a hard question.
More like, how has it changed you?
I've been dealing with this for like 3 years, and it's taken me on such a different path because I was like a soccer athlete before, and now, I can't even run. Now, like, my exercise is walking and playing golf. So it's really taken me in a different path, but I like the path that it's taken me. I enjoy the things that I do and can do. And I've met so many amazing people in my journey, MIB Agents, all of you guys. So yeah, it's just changed me a lot.
Yeah. How about you, Kara? Can you answer the same question?
I think I have more empathy for people. I understand what it's like to be in a medical situation, but also I understand that sometimes I can't understand what other things are like, and to respect all different people, all different shapes and sizes, all different body types, just everyone, because you never know what someone's going through, no matter how they look on the outside.
I think you can only really learn that lesson. Like, you see that sign, everyone's fighting a battle that you don't know. And you go, oh, yeah, that's true. But when you're the one who's like, you look fine on the outside, but you're struggling to get from the car to the grocery store entrance, or like, and you look, I mean, I know I look fine-ish on the, on the outside, like nobody could tell. Like, I think you only really learn that lesson when you are that lesson, when you are that person. Maeve, how about you? How has it changed you?
I feel like Kara really said that so beautifully. But I really echo her sentiments in that I think how has it not changed me, really? Because it at this point has been so much of my life. But I feel like it has really like deepened my desire to actually connect with people and get to know them and understand where they're coming from. And I feel like it really has put me on a trajectory towards like really wanting to pursue medical school and being really passionate about pediatric oncology and the American healthcare system in general, which I'm really grateful for.
It gives you a new sense of appreciation for life, and just, letting small things make you as happy as big things. And the only reason everyone loves the weekends is because, you know, you rue the weekdays. It's kind of like the same thing where you realize how special and great life is when you kind of have it pulled away from you for an extended period of time.
I think it brings you down to like bare bones, like for osteosarcoma. It takes you down to bare bones, and even takes some of your bones, usually does, but like it's really hard to explain. Like, you know, often throughout your life, people go, well, who are you? And you're like, well, you know, I'm a banker, or I'm a wedding planner, or I'm a whatever. And it's like, no, who are you? And I never could get to the core of that question until I went through this. And I realized I'm not the car I drive. I'm not my occupation. It's not that I'm a mother, I'm a sister, I'm a, you know, all of these other things. Like, it really takes you down to your soul and makes you go, oh, okay, what is this about? Like, who am I really? Because I was a runner before and I can't run anymore. Like, so you have to really think about, well, who am I? And how does that change you? And like to Kara's point, you know, being kind with other, you know, all different shapes and sizes and where people are at in their journey in life. This really helps with that, because I weigh more than I've ever weighed before, but because before I run, like I could eat whatever I wanted to. And now, you know, you can't anymore. It like, but I still am who I am. I'm a little bit different because of what I've gone through. Okay, quick question, and then we'll move on to Maeve. How do you feel mentally? Do you, because you all, this question is coming in, it's not from me, but it's a great question. You can come across as like really powerful and strong, and I beat this thing, and like I'm on my way, and I just went through this treatment, and people call you inspiring and courageous and all of these things. How are you really? Like, how are you really? How are you really feeling? Do you feel as strong as you appear? That's the question.
That's definitely a loaded question. I think it changes every day. You know, I think also with having osteosarcoma, I just feel things really deeply. So sometimes when other people are going through things, I just feel it. But I take it day by day. I'm, you know, everything that Brandon said, when I'm down about something, there's always something to be grateful for.
I agree that it's definitely still a day by day thing, even 7 years out from treatment. I think that there are days where I do feel strong, and I can remind myself of how resilient I've been and what I've been through. And that is like motivating for when little things do come up. You can kind of center yourself and be like, no, it's going to be okay. And then there are days too where you're connecting with someone and it kind of brings you right back to where you were when you were in treatment. And that can also be like really emotionally challenging, but at the same time, very rewarding and helps me be more grateful for where I'm at now.
Yeah, absolutely. You know, comes in ebbs and flows. It is, you know, situational as to what's going on around you, or sometimes it's internal, where if you're, you know, upset you can't do something that you used to be able to. So it is a day-to-day struggle. And you know, Anne said she's 10 years, Maeve is 7, and it probably goes on forever in a way.
Yeah, all what you guys said, but also especially after having this surgery, I've learned, you know, you can have a bad day and that's fine. Not every day you have to, you know, walk farther or do more, because, you know, not every day is a good day, but there's always good things in each day. And I use that for my motivation.
Okay, awesome. Thank you guys. Could seriously just sit and chat all day. Maeve, over to you.
Okay, great. Let me share my screen. Okay, so I'm here today to talk about connecting after cancer, and more specifically, one of my favorite MIB programs, Ambassador Agents, and how I'm involved with the program and the benefits that I've had from being a part of it and talking to people that I've worked with in the program. But just a little bit about me. My name is Maeve. I am 21 years old and a two-time osteosarcoma survivor, now 7 years NED, as I had said, and a rising senior at Northeastern in Boston, where I'm studying health science, hoping to go to medical school. I was originally diagnosed with osteosarcoma when I was 11 in 2011 and was treated with MAP chemotherapy and had limb salvage surgery. I had a really rough orthopedic recovery for the 2 years that followed completion of chemo, until ultimately having a localized recurrence in 2014 at the age of 14, at which point I had an above knee amputation. And it's funny that my topic is connecting after cancer, because it was through a connection with Dr. Katie Janeway, who's a brilliant oncologist at Dana-Farber, at MIB's Factor conference in 2020, that I was given the opportunity to work with her in her lab as a co-op student, where I've been since January. And interestingly, my connection with MIB actually goes back farther to when MIB actually existed. I was treated in 2011 at Memorial Sloan Kettering and had briefly overlapped in treatment with Anne. And I continued seeing Anne when I attended a CAC2 conference on Long Island in 2017. And she shared more with me about the wonderful programs and things that were being developed to make it better for kids with osteosarcoma. And I ultimately realized that it really would be healing for me in survivorship to engage more with the osteosarcoma community. So I attended the Factor conferences in 2019 and 2020 and trained to be an ambassador agent, which I can talk about a bit more soon. I was also invited to be on the inaugural MIB Junior Board in 2019, and am now incredibly humbled to serve as the Junior Board President for this year. And over the last year and a half, our work at MIB has become even more important in the COVID-19 pandemic, as the isolation that osteosarcoma patients face, that we know all too well, has been even further exacerbated. But our work did not stop. If anything, it picked right up. So if you're wondering what is the Ambassador Agents program, Ambassador Agents themselves are survivors or family members of survivors that go through an 8-hour interactive training with a licensed social worker prior to receiving a match. And matches are available to everyone connected to osteosarcoma, whether that be the patients themselves or their parents, siblings, grandparents, etc. Ambassador agents are welcome to train 1 year out of completion of treatment. And the program itself has a process of connecting patients and caregivers to survivors and their family members through either geographical area or by similar treatment history, age, or just other experiences. And ambassador agents are dedicated to providing their matches with support and hope. So as individuals who have walked the osteosarcoma path, we're just here to understand and to hear you and to listen, so you know that you're not alone. And a cancer diagnosis is an isolating experience, both for the patient and for their family. And suddenly you really aren't able to share in those same experiences that you had with your friends and peers and classmates, extended family. So you just really do need a little bit of extra help in navigating the world, and MIB is there to help make it better. And this happens through hospital visits, or especially recently through virtual connections. And that can be text or email, FaceTime, Zoom, really whatever makes the match feel the most comfortable. It's really up to them. And what are the benefits of being matched to an ambassador agent while in treatment? So as agents, we just know that treatment for osteosarcoma is grueling in a way that most people in our lives just can't understand if you haven't been through it. And the chemos and surgeries are aggressive and painful and really unique to our community. So being able just to talk about this and understand one another is powerful in decreasing isolation and all of the feelings that come along with going through this treatment, because for a rare cancer, Anne says this, it really isn't rare enough. And unfortunately, there are others that do understand, but they make themselves available to talk with you. And we also know that people thrive better when they're offered a community, and ambassador agents are a source of this community to kids and their families in treatment and into recovery. That just allows a space to more easily talk about whatever they're experiencing or feeling. And when an ambassador agent asks you, how are you? Or how is PT going? Or how is school going? Or have you seen your friends? We really mean it. And we're generally interested in knowing because we've been there and we've had those same experiences. So the overall benefit of being matched while in treatment is really just to feel less lonely and to gain perspective from someone else, and to hopefully decrease your worry just by sharing it and getting it off your chest, and to feel hopeful that maybe you will get to the other side too, and to learn how to better advocate for yourself. And for me, why do I do this? What are the benefits of being an ambassador agent? I have learned just that by getting to share my story, it not only helps the person that I'm matched with, but it also helped me to gain more of a perspective and understanding of what I went through, and learn how to more be able to fully share that. And I also really personally believe in the idea of being able to pay it forward. And I know that I have a lot to be grateful for, and I have a lot of people to be grateful for. And I recognize that my time in treatment really would have been easier had I had an ambassador agent to talk to. So I really then believe in just reaching out to others and making myself available so they have that opportunity that I would have liked to have had. And I also myself have really gained a deeper sense of community in this role and built really strong relationships with other people in this osteosarcoma community. And it's really kept me close to my passions in pursuing medicine. And also just important to note about this too is that every survivor shouldn't be expected to, make it better in this way. There are tons of ways to make it better. And while I really benefit from this role, it also can be really hard and it can be really emotional. But I definitely am very glad that I am a part of it. And just as a final note, the goal of treatment is survivorship, which a really important part of that is making and maintaining healthy relationships. So the program of ambassador agents helps to decrease that isolation and allow pediatric cancer patients to better understand what's happening to them and how to share that, so they're more prepared to connect after cancer. So if there are any doctors in the audience, please encourage your patients to pursue a connection, because I know that can be a hard thing, and a lot of, myself included, can easily kind of dismiss wanting to talk to someone, but it really is very helpful for many people. So that's my plea to you. But I am also open to answering any questions.
First of all, I have to say that Maeve, being the effervescent, lovely, outgoing person that she is today, was not the person I met years ago. Really quiet, and I can see why you're passionate about this program in particular, because you were that quiet person that I don't want to talk to anybody.
Yes, definitely.
But you're, I remember at Factor 2020, you were like, I was that person, but after talking to somebody and finding people in the community that went through the same thing I went through, I really wish more people would join, and especially the young adults, accept being able to talk to somebody about it outside of their family. And I think that's a powerful thing. It doesn't take the place of therapy in any way, shape, or form. So I'm not making that parallel, but sometimes you just need somebody outside of your family to express your things that you're going through, that they will also understand. And there are things you can't say to your family because you're worried you're going to cause them more pain, and you're already causing them pain. And I know that's a struggle. So I'm so proud of you, Maeve. It's just amazing that you are pursuing a medical track and like president of MIB junior board, you're just amazing. Can you talk a little bit about the training program? Can you just say, hey, I want to be an ambassador agent?
So the training program is 8 hours and you meet virtually over Zoom, so you can train from anywhere. And it's with my mom, who is a licensed certified social worker. And I think that the training in general kind of just is really applicable to all areas of life too. I think that it helps you be a better listener and it helps you be a better communicator. And I think it's really easy to go into situations thinking that you need to have the answers, but really a lot of times you just have to listen and ask questions, and people know their own intuition and what's best for them, and you can just help them, guide them there, and be a source of support. And I think that the training is really powerful in helping you learn how to do that.
Yeah, I think the training actually makes you a better person as well. Like it really does. Like it teaches you how to approach a new person and say, kind of give your 30-second interview and then say, how are you? Tell me about you. Tell me what's going on. Like it's a really powerful training program, not just as ambassador agents, but I think as doctors, as humans, it's really something you should learn in school, how to speak to another human being like that. One of my favorite things from ambassador agents, one of my favorite pieces of feedback is when, we check in with them after and we say, how did it go? Or, how are you feeling? And the feedback coming back that says, my agent was so helpful and so thoughtful. And, I got all of these resources that came in a tote, which by the way is informed by the junior board from 2020 and by caregivers. And you get this tote bag full of good stuff. And the person walks in and you have this great conversation. And then the feedback comes back. My agent was great. The resources were great. Just to have somebody walk in the room and say, I've been where you've been. Tell me how you're doing, was just, it brings people to their knees. Like it's really a powerful thing. Anyway, so thank you for doing that. And we have Oscar Ortiz, who I'm going to turn his mic on. And he has something to say. Let's see,
Hey,
Oscar, did I get you?
Hello, can you hear me?
Hi, Oscar.
Hey, how are you, Anna?
Good, how are you?
I'm doing okay. I wanted to thank you for putting together this program. I'm a parent of a young man that we lost to cancer, and he wanted to do what you guys are doing, and what you do is incredibly important. I can't tell you how important it is, and I think some of you are a little further along, and as you grow and you become old like I do, it's incredibly impactful. And I think on so many levels, on the direct level that you've had with the people you interact with, but I'd say beyond that, in bringing awareness to something, that, I say generationally, I lost a little cousin to cancer I never met. I'm 50 years old. He passed away before I was born. Back then, people didn't talk about this. It was sort of what happened, and you sort of, feelings. You didn't talk about feelings. You sort of, all right, this was the unfortunate truth, and you kind of, what you guys are doing is being ambassadors beyond what you recognize. And the reason that we don't have better solutions is because not enough kids get cancer. And that's an ugly, ugly truth that needs to change. We see what we're capable of as a society with what we've done with COVID. I'm not comparing cancer to COVID in terms of what it does, but the reality is that level of collaboration can only happen if we sound the alarm. And you guys are amazing. I'm touched incredibly by what you're doing, and Anne, but what you've been doing for a long time. Together, we'll make this better for others. So thank you for allowing me to share briefly, Anne, and thank you guys for what you're doing. It's really, really important.
Thanks, Oscar. Thanks for what you're doing too. Really amazing work you're doing. Thank you. Thank you. Thank you. So we've come to the end of our conversation today, which for me could go on forever. Like we have so much to talk about still, and I think we've got to do this again. And I wholeheartedly need to add that I agree with everything Oscar said. We can only solve this colossal problem with all parties on board. And I think all parties are willing. We just have to get together at the Factor Conference again in February. So thank you to the junior board in general, and thanks Kara, Maeve, Brandon, and Charlotte for what you guys do. This is not a junior board that is just a junior board in name. This is hard work that we do, and it is hard to go back into this space, and these junior board members do this regularly with us and for us, and they help inform who we are as an organization and what we do. So I'm forever grateful to the junior board, and I could spend another hour talking about that part, but I'll stop now, and because I have some MIB Agents news I have to share with you. And here it is. Next week, I and Team MIB are traveling to Los Angeles and San Francisco. You are welcome to join us. We have a program now called MIB Mingles that we'll be having throughout the country now that we are mostly past COVID. Our first one is in Newport Beach on Thursday, August 5th. And following that, we'll be in Walnut Creek, California for Hess Fest, which is a music festival, which benefits MIB agents. That's on Sunday, August 8th. For more information on both of these really cool get-togethers, please go to our website, mibagents.org/happening-now, or just go on our website, you'll find it. We are back on August 12th with Dr. Abha Gupta. She is staff oncologist, solid tumor program at Sick Kids, and associate professor at University of Toronto. She will be presenting on fertility preservation for pediatric cancer patients. Until then, many thanks again to our brilliant and amazing junior board who make it better every day through their leadership within MIB Agents. Charlotte, Maeve, Kara, and Brandon, thank you. Thank you. And thank you all for being here with us today. We hope to see you next week in person and then here on OsteoBites on the 12th. Thanks, everybody.